Grebner, and today I'm going to be demonstrating how to do a wet to dry dressing change. So first I would come in, I would provide privacy for hand hygiene. I would identify the patient using two identifiers, and I would ask them to repeat their name and date of birth back to me. I would raise the bed, lower the side rail. I would have given them a pain med 30 to 60 minutes ago to make sure that it's kicked in. I'm going to ask them to rate their pain and comfort level on a scale of 0 to 10. And then I would start my procedure. I'd get all my supplies, have a biohazard bag to put in all the dirty dressings. And then I would have looked at the physician orders to note the location and measurements of the wound the last time it was changed. So to start, we're going to expose the wound just where the wound is, maintaining privacy for the patient. And I would have performed hand hygiene. Alright, we're going to put on our gloves. We're going to take the old dressing off carefully. Careful to peel the tape off. You would put this in the biohazard bag. Take the gauze off. And then I would take the inside dressing out, pulling out slowly in case it pulls stuff out. And then I would note the color, if there's any odor, discharge, pus, everything like that. I'm going to get rid of my dirty gloves. And then I'm going to measure the wound. I would chart this to see if there's any improvement or not. And then I would note the length of it. So it's about 13.3 centimeters. And then the width of it is about 2.1 centimeters. And then I would do the depth of it. I'd take this in there and go with the deepest point. And then I would mark it on there. And it's about 3.5 centimeters. I discarded that. Get rid of my gloves. I would have performed hand hygiene for all that. And now we're going to put on the clean dressing. So put on gloves after performing hand hygiene. Bin the packet of gauze. Pour a little of your solution into it. Make sure that it's damp. This one. And then you're going to pack the wound. And you're going to use the other Q-tip to push it in there. You would note any tunneling, if it goes anywhere, if your dressing does. And you would add one more. Make sure not to go over the top of it, but you want enough in there. I would explain all this during the procedure to the patient. Right, and once I'm done packing the wound, making sure it's not coming over the top of it, like that, you're going to put two clean dry gauze over the top of it. The smaller ones. big one over it. You want the blue side on the outside to be able to tell if there's discharge or anything. And then you're going to tape the sides of it. Then I would discard all my gloves. I would perform hand hygiene, make sure everything's okay. I would make sure that the patient is okay. Put his call light up, see if he needs anything, make sure that he's not in pain. Tell him any precautions about his wound. If he needs anything, I would raise the bed rail, undo the curtain, wash my hands, and that's how you do a wet to dry dressing.